Hi, I'm Dr. Daniel Charek, sports neuropsychologist and clinical lead of our comprehensive concussion clinic here at Northside Hospital. I'm excited to have the opportunity to talk with you all today. I'm also looking forward to working together moving forward. The world of concussion has changed pretty dramatically. As many of you know, there's unprecedented attention on this injury. And from that, has come a lot of research and an enhanced understanding of both how do we assess the injury and how do we treat it most appropriately. So we're past the days where we simply ask an athlete who might be motivated to get back on the field, how do you feel, and use that as a determining factor. Now we're going to use cognitive testing data, look at memory scores, processing speed scores. We're going to look at different eye movements, different head movements, and make sure that the brain is processing information in the way that it needs to. And we will use that information both to determine when an injury has happened, but also use that to determine once someone is fully recovered and it's safe to get them back on the field. The way that we treat the injury has changed quite dramatically as well. We've really moved away from more passive rest-based treatments towards more active recovery and active rehabilitation. So many of you, if you've been treated in the past for a concussion, had probably heard rest. And what we've learned is that rest is not always the best approach. We can actually get better outcomes with the right targeted recovery. We have various therapies or home exercises that we can have you do. We can give you the right prescription of safe exercise that can help you recover. Another change is that we want to get you back into activity in a progressive way, but support you appropriately. So for instance, school, that's often a big concern for parents. And what our goal is not to hold you out of school for long periods of time, but get you back into school with the right accommodations and right support. So we might give you extra time or lots of breaks or put some prescriptions on the type of school activities that you can do. So in general, the goal is to figure out what does your specific concussion look like and what targeted therapies, targeted support, and targeted rehab do we have to do to fully get you back to baseline as quickly as we're able. Because when we do that correctly, we do the right assessment techniques and use those to determine once you've fully recovered, we can feel confident about getting you back on the field. So in terms of working with us moving forward, we want to make sure we give you direct access. The easiest way we're going to do that is through a Concierge concussion hotline number. Essentially what that's going to do is give you a direct line to us that will go straight to my athletic trainer, Jared, who works side by side with me each day. He can get you directly on the schedule. He's also a great resource for answering initial questions and kind of giving you the steps that you need prior to coming into the office. So that makes sure you're not sitting on a phone tree, you're not pressing numbers. You'll have a direct line to our clinic for questions and for scheduling. Our goal is to get you in the office quickly if an injury does occur, get you set up with a very specific targeted treatment plan, and then also help make that determination of when are you fully recovered and when is it safe to get you back in the field. So again, I'm Dan Charek, excited to be working with you guys moving forward.